Preparing to quit. There are 4 key factors when preparing to quit. The first is making the decision to quit. The second is setting a quit date and making a quit plan. The third is dealing with withdrawal, and the fourth is staying quit. When you're picking a quit day, it's important to mark your calendar, tell your friends, remove any temptations, and decide on a plan. You need to make sure you're changing your habits and also rewarding yourself.
An important part of preparing to quit is deciding whether or not you want to use nicotine replacement therapy. Nicotine replacement therapy gives you nicotine using things like gum, patches, sprays, inhalers, or lozenges, but it doesn't have the other dangerous chemicals that commercial tobacco does. Nicotine replacement therapy in combination with partaking in a smoking cessation program can increase your chances of staying quit by reducing withdrawal symptoms and cravings. Nicotine replacement therapy should not be used while you are still smoking, but you can begin using these products as soon as you stop smoking. There are several different doses of nicotine replacement therapy based on how often you smoke and how strong your cravings are. Let's go a little bit deeper into some of the available types of nicotine replacement therapy. First, there's the patch, which gives you nicotine through the skin and gradually weans you off nicotine. Patches come in different kinds and in varying strength. Some patches are over the counter while others are prescription. A new patch should be applied approximately once a day for 10 to 12 weeks. Next, let's talk about gum. Gum gives you nicotine via the mouth and is available over the counter. It should be chewed slowly and then left in your mouth for 20 to 30 minutes. Be sure not to consume acidic food or drinks before and during gum use, and do not use more than 20 pieces of gum per day. Finally, let's talk about lozenges. Like the gum, these are available over the counter. They can be used in a dose-decreasing manner for 12 weeks and should not be used while eating or drinking. While all of these have some side effects, there's no one way that's better than the others. Rather, it's about what works for you. Remember, the purpose of nicotine replacement therapy is to gradually decrease your body's cravings for nicotine. Another way to help you stay quit is to use pharmacotherapy, which is a fancy way of saying prescription drugs. 2 examples of these drugs are Zyban and Chantix. While both of these drugs work to lessen withdrawal symptoms, Chantix also reduces the amount of pleasure you get from smoking. As with nicotine replacement therapy, both of these drugs have side effects, so talk to your doctor if you're thinking about taking either Zyban or Chantix.
So, let's look. Who smokes? It's actually been revealed that 14% of the US adult population aged 18 and plus smoke. When broken down by race, it's been revealed that 20.9% of the Alaska Native and American Indian population smokes, 14.9% of the Black community smokes, 8.8% of the Hispanic community smokes, 7.2% of the Asian American community smokes, and 15.5% of the white community smokes. So, what is in a cigarette? There are over 4,000 chemicals in cigarettes. A few of the chemicals are listed below. There's acetone, which is in nail polish remover, ammonium, which is in floor and toilet cleaners, arsenic, which is poison that's also used in pesticides, benzopyrene, which is found in coal and tar, carbon monoxide, which is car exhaust fumes, cadmium, which is found in rechargeable batteries, formaldehyde, which is used to preserve dead bodies, hydrogen cyanide, which was used in gas chamber poisons during World War II, nitrobenzene, which is gasoline additives, and toluene, which is found in paint thinners. So, how does smoking cause illness and death? Half of US adults keep smoking will die from the habit. Smoking kills more US adults than alcohol, car accidents, suicide, AIDS, homicide, and illegal drugs combined. The cancer caused by smoking is listed as such as lung, larynx, which is your voice box, oral cavities, which is your mouth, tongue, and lips, pharynx, which is your throat, esophagus, which is the tube connecting the throat to the stomach, pancreas, cervix, kidney, bladder, and acute myeloid leukemia. Some other health problems that can also occur are heart disease, aneurysms, bronchitis, emphysema, and stroke. Smoking will impact your quality of life and how long you live. Nicotine is a very powerful addiction. It's also important to note that it can lead to reproductive issues and SIDs. Lastly, breathing problems are linked to secondhand smoke, so it's very important to realize your impact on your friends and family. So let's look at some benefits when you quit smoking. So after 20 minutes of quitting, your blood pressure will return to a normal level. 8 hours after quitting, carbon monoxide is in the bloodstream is cut in half. 3 days after quitting, the ability to breathe is easier. 2 months after quitting, your circulation improves and lung function is increased up to 30%. 1 year after quitting, the risk of heart attack is reduced by half. 5 years after quitting, the risk of stroke is reduced to that of a non-smoker. 10 years after quitting, the risk of lung cancer is reduced to that of a non-smoker. And 15 years after quitting, the risk of heart attack is reduced to that of a non-smoker. So let's talk about electronic nicotine delivery systems. So what are they? There are many different tobacco products that are on the market other than cigarettes. Electronic nicotine delivery systems have become very popular among both adults and youth. The products are battery powered, which heat in vapor that can be inhaled. It's not proven as a quit smoking aid, but personal reports say that ENDS have helped in quitting smoking cigarettes. However, it is still important to note that they can have health effects that are not fully known. So let's look. Why do people smoke? Some of the reasons people smoke are nicotine addiction. Nicotine is a drug that is found naturally in tobacco. It is as addictive as heroin or cocaine. Nicotine causes pleasant feelings that make smokers want to smoke. A tolerance can be formed to nicotine, requiring the need for more nicotine. There's also stress. Stress is a part of everyone's lives, and smokers have come to use nicotine to help cope with stress. It is important to find other ways to cope with stress. A few ways to cope with this is through physical activity and spiritual practices.
Coping with withdrawal symptoms. Just as your body gets used to having nicotine, it will need time to get used to not having nicotine. Quitting smoking without using medications can bring about a variety of symptoms associated with withdrawal. These symptoms can start within a few hours of your last cigarette and last for several weeks. The symptoms will get better every day that you stay smoke-free. A few possible withdrawal symptoms are depressed mood, irritability, anxiety, restlessness, dizziness, and tightness in chest. Some ways to cope with these would be to exercise, reward yourself for your efforts, use medications, do deep breathing exercises, use relaxation techniques and physical exercises, take caution and change positions slowly if experiencing dizziness, and use relaxation techniques and deep breathing for battling tightness in chest. When coping with withdrawal, you will need to deal with some of the cravings. And one way to do this is to think ahead. If you know of triggers that will be hard for you, you will be able to prepare for them. For preparing for cravings, think about what you will do if you indeed do have a craving when a situation arrives. Some behavioral coping skills include leaving the situation, calling or talking to a friend who will listen, exercising, taking deep breaths, doing something with a non-smoker, eating or chewing something. And mental coping skills involve reminding yourself of the reasons you wanted to quit. Think of how long you have been cigarette free. Try to figure out what is making you want a cigarette in the moment. Tell yourself that smoking will not solve any problem. Think of how your health is improving and telling yourself no. Say it out loud. Some other tobacco products and your health. Smokeless tobacco, which can include snuff, chewing tobacco, and snus, can offer the same nicotine dependency as well as withdrawal symptoms as smoking. Some health effects of using smokeless tobacco include oral and throat cancer, cancer in the esophagus, stomach cancer, receding gums, and tooth loss. Another form of tobacco is pipes or cigars, which are another form of inhalation tobacco. When inhaled, nicotine is absorbed as quickly as it is with cigarettes. When not inhaled, nicotine is absorbed much more slowly through the lining of the mouth. But both inhaled and non-inhaled nicotine are highly addictive. Some health risks for smoking pipes or cigars include lung cancer, lip, tongue, mouth, and throat cancer, esophagus cancer, and larynx cancer. Stress management. Stress is what we have when life gives us challenges. These can be negative and happy events. Some major life events can be stressors. Some of these events may be the birth of a child, money, death of a loved one, or actions and words of others. Some daily hassles can also be stressors. Car trouble, traffic jams, housework, bad weather. How is health related to smoking? People who have a lot of stress tend to have a harder time quitting smoking. Nicotine causes the brain to release chemicals that can make someone feel better for a short period of time. Therefore, people may turn to smoking as a way to relieve stress. Things to remember: smoking does not solve your problem, it only hides it. Smoking is not a healthy way to deal with stress, and the stress probably will not kill you, but the smoking may. How can you manage stress? Deal with the problem. Look at the source of the problem and think about ways to solve it, and then act. Some techniques may be taking a warm bath, getting a massage, meditating, or reading a book. Getting enough sleep is also an important way to decrease levels of stress.
Weight management. What causes weight gain after quitting? Nicotine in cigarettes raises your metabolism and your appetite is increased after quitting. You may feel a need to have something in your mouth. People use food to deal with stress, as a reward, or to be social. Who gains weight? The average person who quits smoking gains between 4 and 10 pounds. The average smoker weighs 4 to 10 pounds less than the average non-smoker. The more you smoke per day, the more weight you will gain after quitting. As your body adjusts to being an ex-smoker, you should start to lose the weight that you have gained. However, this process can take up to about 6 months. In order to control your weight after quitting, it is important to have a balance of healthy eating and exercise habits. This can include limiting fat intake, having healthy snacks ready, and making sure you plan a balanced diet. In addition, it is important to have good exercise habits, such as taking a 10-minute walk 3 times a day, simply parking your car further away from the door, or walking while you talk on the phone. Support of family and friends. Many former smokers say a support network is very important during their quit attempt. This can be coworkers, friends, your significant other, children, parents, siblings, your family doctor, etc. Try to spend time with non-smokers and ex-smokers who support your efforts to quit. Here are some helpful tips. Let everyone know that you are quitting, and let the person know that you need to spend time doing things that will keep your mind off smoking. For example, go to the movies, take a walk to get your mind past a craving, or take a bike ride together. Do not be harsh with the person during your nicotine withdrawal. Your grumpiness could be taken personally. And celebrate along the way. Quitting smoking is a big deal. When you quit, remember, quitting is a major accomplishment. It takes strength and commitment, and you can do it. Staying quit is an ongoing battle. You need to plan ahead, avoid triggers and old routines, and reach out to your support. What happens if you slip? Staying quit may take several attempts, but the most important thing is to get back on track. If you had any questions about this presentation on smoking cessation, contact Luke Swimmer at lswimmer@lehigh.edu. Thank you.